Hi there, welcome to week 4 of my 6-week myofascial release course. And today we're going to be looking at releasing tension in the mid and upper back, the thoracic spine, sort of around the rib cage, and then also my personal favorite, working into releasing tension in the neck, which is, I think, for many of us, a place where we can tend to hold not just our physical stress, but also our psychological and emotional stresses as well. So for this practice, you'll need a foam roller. You'll also need something like a yoga block. It doesn't have to be a yoga block. It could be a couple of thick books, something that you can rest your head on. And you'll also need 2 soft myofascial release balls. Preferably if they come in a tote bag, I would recommend that, but you can also, of course, put them in a sock and then just tie them up so that they don't spin away from each other. So we're going to start our practice with the more kind of broad and general sort of techniques for the upper back, and then we're going to move into some slightly more targeted trigger point work with the myofascial balls, and we'll finish with some work for the neck, which also tends to be quite calming for the nervous system. So it's a really lovely way to end the practice. So to start, we're going to begin with using the foam roller, and we're just going to go, as I say, for a more general approach to targeting the thoracic spine. So you'll come onto your back, and I'm going to put the foam roller just right underneath the ribs, sort of roughly around the shoulder blades. Ladies, if you have long hair, just to make sure that that doesn't get caught up in the foam roller, it's really unpleasant. And support the back of your head here with both hands. Knees are bent, feet are flat on the floor. And I'm just going to start by picking the hips up and then using the feet to just slowly start to roll up and down the length of this upper back area. I'm really just covering today in this sequence the area at the bottom of the ribs all the way up to the top of the ribs. If you're interested in working into the lower back, that was in my earlier session on the hips and the lower back. And I'm just going nice and slow right through the center there. And then you can just start to explore a little bit more through one side. So I'm going to pick the hips up, shift a little bit over to the right, and just start to roll a little bit more now, specifically on that right side, getting into some of the soft tissue just on the inside of the right shoulder blade. Finding some good things in there. And then also trying that on the left-hand side, leaning a little bit over to the left. And again, using the feet to help push, pull you up and down. And I'm using this in a fairly kind of general way to, really get a sense of the state of the tissues, if there are any particular areas that are feeling more talkative, more sensitive. And then I'm going to come around and start to just work a little bit more on the sides of the ribs here and bring the foam roller just right underneath the right side of my rib cage. So I'm just below my armpit here, and you can have the legs in any comfortable setup. You can support your head with your bottom hand or keep your head lifted. And I'm just going to start to roll towards the chest, a little bit at the front, and then under the ribs, under the armpit, a little towards the back of the shoulder blade, getting into some big muscles here, the latissimus, back muscle, the pecs at the front, and a little bit into the rotator cuff, the back of the shoulder. And it's tricky when you're working on devising specific sequences. This is a sequence, as I say, more for the mid and upper back and the neck, but there is some shoulder work certainly involved in this as well. Kind of hard not to get the shoulders at the same time. And again, I'm just using this sort of cross-fibering technique just to get a sense of any areas that may need a little bit more attention. I'm going to bring that foam roller down just a little bit lower. I'm on the slightly lower part of the ribs. And do the same thing here, from side to side. As I mentioned in previous videos, use your breath as a way to just monitor how your nervous system is responding. Obviously, with all of these techniques, we don't want to, you know, go so deep into these techniques or create so much discomfort that we're having trouble or a hard time relaxing into them. Okay, let's switch to the other side. So same idea. I'm just going to put the foam roller. First one, I'll go just a little bit higher, right underneath the armpit. And again, I'm just rolling from front to back. Nice. Again, fairly broad, non-specific massage for all of these muscles that wrap underneath, including some important shoulder stabilizing muscles as well. Noticing how this side maybe compares. And then bringing the foam roller down just a little bit lower. Might feel like you're rolling over little speed bumps here. Get into the ribs. Of course, the rib cage attaches to the thoracic vertebrae. And so these techniques also can have a really kind of lovely side benefit on improving breathing and breathing biomechanics, freeing up any tension that might have got stored up in the rib cage. Okay. All right, and then from there we can press the floor away, come out of that position, and you don't need your foam roller anymore for this one. We're going to start to work a little more targeted now in the thoracic spine using the myofascial balls, and I'm actually going to keep them in the tote bag for this particular technique. And we're going to be working on 3 spots, and I'm going to work on the sort of upper part of the shoulder blades, right between the shoulder blades and the spine. I'm going to come down then kind of midway down between the shoulder blades and the spine, and then I'll be coming down to the bottom of the shoulder blades, just below the shoulder blades. So 3 main spots here. You may find for these techniques that you need a block for your head. This will really depend very much on your sort of posture and the shape of your spine. Sometimes the trickiest bit is just kind of getting the balls into a good position to start, but I'm just going to use my hand to help me there, and I'm just getting the balls in, as I say, right kind of in this upper part of my upper back, right around the very top of the shoulder blades. So I feel pretty comfortable here without anything underneath my head, but as I say, if you feel that you need to put something underneath your head, that's one option. Another variation that can put a little bit more pressure into this area, so if you feel like you could do with a bit more pressure, you could also put the block underneath the hips, which can also feel really, really helpful here. I'm gonna work with that today. So I'm just gonna use my feet now to, again, just create a little sort of chugging motion, a little rolling pin action, and just rocking a little bit up and down on the balls. And of course, all of these ways of working will really depend again on your body. If this is an extremely tender area for you, if this is really intense, you might just be still and just focus on breathing into the upper back and trying to relax as much as possible. But for me today, it's feeling quite nice to move a little here. And just another couple of options is to, rather than using the feet to create the movement, is actually to move from that part where you've got the myofascial balls. And you can create a little, almost like a mini cat-cow, if you're familiar with cat-cow in yoga. On your in-breath, you're sort of arching your upper back a little bit away from the balls. And then as you exhale, you can round and sort of push your back into the balls. And that creates, again, a nice little massage effect, moving the balls a little bit up and down. Helpful. Or other options here might be to explore
being still with the back, with the spine, but maybe starting to explore some big movements of the arms. You may find for many people when they take the arms sort of up and over the head, again, that sort of intensifies things a little bit here. So again, just let your breath be your guide. I've done this myofascial work on my upper back many, many, many times. So I'm fairly tolerant to what I can do here. But again, you may be more sensitive. So just respect how your body is showing up here. And to be really clear, I'm on the soft tissue on either side of the spine. I'm not massaging directly on the spine or on the shoulder blade. Those soft tissues just inside. Now, for this next point, I'm going to move the block out from underneath the hips. And there are a few different ways you can move the balls. You can manually move the balls down, just use your hands to manually move the balls down. Or you could pick your head up, you support your head with your hands and use your feet to sort of push yourself down so that the balls feel a little lower. And sometimes that works, and sometimes you, like I'm doing, you have to kind of readjust a little bit so that they feel nice and balanced. And again, assess. Now I'm kind of midway down between the shoulder blades and the spine. This is where potentially it might feel helpful to bring something underneath the head again. For this one, and again, all of the same ideas apply here. You could use your feet to create a little push-pull or rolling pin action. Or you could keep the feet and the legs passive and again, find a little bit of that arching and then rounding of the back like a little mini cat-cow, lifting the ribs and then rounding the ribs. And you could play with movement of the arms. So hopefully by now, just getting a sense that really anything goes here. Let intuition guide you as to what feels most helpful, what feels useful here in terms of movement or no movement. As I come down the back, one of the options I like to add in here is a little hug, like I'm wrapping my arms around my body and then finding a little rocking movement from side to side. Now, I personally quite like putting the balls in the tote bag and working with them in this way, but you can also do this technique with the balls out of the tote bag. And if you have quite a broad back, that may work better for you. Rocking here side to side, getting a nice cross fibering movement. And really taking some intentional deep breath into the upper back. And you're trying to expand your back as you breathe in and relax the back as you breathe out. Now, I'm going to just move the balls down one more level. And again, I've got the ability in my shoulders to sort of use my hands to do this, just about. But if you are struggling with that, you can again just lift yourself up, manually kind of put the balls in the position. And I'm going for this sort of point really at the bottom of the shoulder blades now. For ladies, it would be maybe about bra strap or even a little bit below that. For men, if you're familiar with wearing a heart rate monitor, it's kind of around that sort of level. And again, I'm going to just find a little bit of movement here that's feeling good to me today. I will say that as we come down the back, again, you may or may not want support under the head. And this can make people feel a little slightly winded. So, you know, we're coming down quite close to the respiratory diaphragm. And again, it can be quite a sensitive area. I often find that people get more sensitive as they come down towards that mid-back area. So again, you may need less movement. Finding a little sway of the knees from side to side is feeling good. Again, you could intensify that by wrapping your arms around your body to expose that area a little bit more to the balls. And all the while, just monitoring breath. sense of how these muscles close to the spine really also have a big impact on shoulder mobility and shoulder biomechanics, breath. And then we'll just roll carefully away from the balls just for a moment, and you can just take the balls out and just come to lie flat for a few moments and just notice and observe how your body is landing in relationship to gravity. And you may sense your back feels heavier or more relaxed, more spread out. Maybe the breath has become a bit deeper in the rib cage, or it's sort of freed up the ribs so you can breathe more into the rib cage. Just noticing what you notice there. And then I'm going to do one more technique specifically with the balls in the tote bag here. And I'm going to work now. We had the balls running sort of in this horizontal plane. And now I'm going to get the balls actually running more vertically. And I'm going to work on, again, the soft tissue, literally on the inside of the shoulder blade. I'll do one side and then I'll do the other side. And I'm working not just on the muscles, the rhomboids here, those muscles between the shoulder blades, but I'm also working on some tiny little muscles called the rotatories that have a big impact on rotation of the rib cage. This is a really nice one to do if you feel a little sticky in rotation. And this could be very helpful in any sports that require a lot of rotation, like golf or tennis. This one, I do like to have a block underneath the head, or again, a book or something like that, or a couple of cushions. So I'm going just to the right side of my spine. I'm just inside of my shoulder blade, so I'm not on my shoulder blade, but just inside that. And then I've got the brick there for my head. Now, you are obviously going to feel very lopsided because the right side is being pushed up here. Just adjust your legs in any comfortable position. And then I've got the balls on the right side here. So I'm going to wrap my right arm around my rib cage just to expose that area a little bit more. And then I'm just rocking the balls a little bit from side to side. So I'm moving the balls right up to the edge of the shoulder blade. And then I'm going right up to just the edge of the spine. I'm not rolling onto the spine, but just to the side of the spine. And again, you might feel this sort of quite lumpy, thick band of muscular tissue that lines the side of the spine. And then I'm going to find a spot that feels a little tender there. And now, rather than sort of moving my body from side to side, I'm now going to create a little twisting action. Just like a little twisting to the right and then back, a little twist to the right. It's a tiny movement. All the while, again, trying to breathe deeply into the back ribs. And you can breathe in through the nose and out through the mouth, or in and out through the nose. Just taking a couple more there. Great. And then I'm just going to come off from that side and switch. So again, the balls are going to be going on the left side now of my back, again, between the shoulder blade and the spine. Probably the hardest bit about some of these techniques is just getting the balls into position. Takes a little bit of playing around with, a little bit of practice. Make sure you're on, again, the soft tissue. So I'm in the inside of the shoulder blade. And then I'm on that left side. So now I'm going to wrap my left arm around my body just to expose the tissues. And I'm going to roll the balls, probably not more really than a couple of centimeters or an inch or so. Again, it'll depend a little bit on the broadness of your back. Moving the balls right up to the inside edge of that shoulder blade, and then just to the side of the spine. And again, rather than moving the body from side to side, I'm now going to create a little twisting movement. I'm just slightly twisting my ribs to the left and then coming back to center. Balls are not going to be moving quite as much, but I can definitely feel it. And you know, one of the things I think is so valuable about this work is you really get to understand where you hold tension in your body. And sometimes it can be quite surprising. It might not be what you expected. Some areas can be more sensitive than you realized, and other areas that you thought might be kind of tender, maybe not so much. Great. Okay. And then I'm going to just come off from that. And again, take a moment. You can take any props up from under your head if you like, or keep them there if they're supporting your neck in neutral. And again, just maybe take a few breaths to close the eyes and feel. Sometimes after this work, particularly in the thoracic spine, I feel an involuntary sigh is needed, or again, the breath has just really shifted. So just noticing. Now from here, I'm going to just roll to the side and make your way up. I'm coming to sitting, and for this, you could definitely sit in a chair. So if you're not comfortable sitting on the floor in any way, please do sit up on a chair. We're going to do a little bit of work for the neck, and I'm going to put a block underneath my hips for a little bit of support. As I say, you could definitely sit on a stool or a chair. You really want to make sure that you have good posture. So elevating the hips as much as you need is really important. I want to make sure, show you from the side, that I'm not in a sort of tucked position in my pelvis. You can see how this rounds my back and it brings me to this sort of forward head position. So I really want to get right up on top of my sitting bones so that my spine can be straight and my head can be right on top of the spine, on top of the ribs. So we're going to start with just a little self-massage for the neck. And I'd like to, we're going to work into some muscles just in the sides of the neck. And we'll also work a little bit into some muscles through the front of the neck. It's really important when you're doing this to be gentle. We have some very important neurovascular structures in the front of the neck, certain veins and arteries, nerves, and of course things like the windpipe, delicate structures that don't have a lot of protection. So we just really want to be very mindful as we're working into this. And actually, for the sake of this video, I'm going to come in a little closer so that you can see hopefully a little more easily. So we're going to start by doing a little release work for a muscle called the sternocleidomastoid. It is a muscle that comes from the back of the ear and has quite a ropey, thick-like structure, and it comes down and inserts into the collarbone or the clavicle. And for some people, this muscle is quite easy to palpate and quite pronounced. I find that it's a little easier to sort of grab it kind of higher up. It gets a little harder to access as we come down, but we can definitely do some stroking work through this. So I'm going to start by taking my hand right up, and I'm looking to feel into the sort of meat of this muscle right behind my ear. And I'm just going to gently start to palpate it with my thumb and my index fingers. And you can really, again, this will depend on how easy this is to palpate. Sometimes if you tilt the same side ear to the shoulder, it makes it more relaxed so you can grab it a little bit more easily. You can sort of gently pinch it and then move the neck away. So I'm relaxing it, gently pinching and then moving the neck away. That one feels quite helpful for me. You can also just find the muscle and just gently rub your thumbs and your fingers there. Just palpate down. Again, I find that's a little bit easier in this top part.
And then as we kind of come down into this part just to the side and in front of the collarbone, you can just stroke it. You can stroke it and glide. And sometimes it helps to sort of stretch the ear away as you glide your fingers down. And again, I'm not pushing in hard here. I'm on the side of the neck. I'm not on the front of the neck. And I'm just sort of following the pathway of the muscle and then tilting the head away at the same time. You're getting a little red, getting some hydration to it. And we'll try that on the other side. So same idea here. I'm taking my thumb, my index fingers. You can see it, quite pronounced muscle in me. It's usually one of the ones that causes me occasional headaches. And I'm just grabbing it with my thumb and my fingers and just gently rubbing and palpating. Again, working very much on the muscle and the soft tissue here. Rub. You can, again, relax the muscle, pinch it, and then tilt the ear away, like a little pin and stretch technique. A little harder to catch hold of the muscle as we kind of come down. So I'm just using my fingers to just graze down the sort of side edge of it here. Again, tilting the head away and sort of stretching the muscle at the same time as I'm lengthening it with the fingers. Great. And then I'll just do one more technique, which is very similar, but is literally just behind that SCM muscle, that sternocleidomastoid muscle. And I'm working into more the side of the neck here, and these muscles called the scalenes. These muscles often get really tight when we are stress breathing, when we're breathing using our neck, or if we're in sort of a high anxious state. These muscles can often end up playing a role of respiration that they weren't really designed to do for the long haul. So I'm kind of just coming in again with my fingers this time and grazing them down the sides of the neck. And then you can add a little bit of a stretch or a side bend of the neck. And you can even sort of come in right under or sort of in front of the collarbone where these muscles insert. Sometimes there's some good little tender spots right just above the collarbone. Again, you can push in and then stretch the neck away. And we can do that on the second side again. So I'm just behind that sternocleidomastoid muscle. I'm using my fingers to sort of graze down the sides of the neck and all the way into the front of that collarbone. Tilting the head away. These muscles are quite thin and sort of strap-like. You can, again, if you feel them with your fingers, they feel like almost like finger-like projections. And again, you might find particularly just above the collarbone, fingers, feels good to press in and then gently lean the head away. Okay, and then we'll do one more stretch here. This is sort of a myofascial release technique for the platysma, which is a muscle that sort of drapes across the front. So I'm going to take my, mirror you here, the right hand just to the side of the breastbone and just below my collarbone. So I'm on the right side of my upper chest, right hand and then left hand, and I'm pushing in and then pulling down slightly. And at the same time, I'm going to lift the chin and slightly jut the lower jaw forwards. And I can feel the stretch in the front of the throat, and I can even lean the head a little bit away from the hands to the left. It's like a really deep stretch there. And then release. And we can do the same thing on the other side. Left hand just to the left side of the breastbone, below the collarbone. Right hand clamps on top, and then I'm pushing in, pulling down. Sunlight's arrived. And I'm going to lift the chin and tilt the head back a little. And a couple of breaths. And gently releasing. Okay, I'm going to get out of this sunlight for a moment and come back down onto the back. And for this one, we're going to be working with the myofascial balls. We're going to do one technique just with the one ball, and then our last technique will be using the two balls back in the tote bag. So I'm going back to this sternocleidomastoid muscle, and what I'm looking for here is a point. Come in a bit closer just so you can see this point right behind my ear where the sternocleidomastoid muscle sort of originates here, and I'm going to put the ball more on the skull rather than so much on the neck, and just where the neck and the skull meets in this little bony prominence just behind the ear. Now, if this technique feels too intense, lying down with putting your weight on the ball, you could just do this manually with your hand and press in, and just with your hand there, just apply some pressure, and you can twist in with the ball and just give that whole area a little massage and knead with the ball. But if you can tolerate pressure here and it doesn't feel too intense, you're going to lie down on your side and put the ball right in to that area. So you're resting your head right on that point, right behind the ear. Now I'm just going to use my hand here just to keep the ball steady so it's not going to go anywhere. It's not going to suddenly slip out. And I'm just initially just letting the weight of my head rest on that point, right in that little bony prominence just behind the ear. And this actually feels really good here, just to be still. Some deep breath. But if it feels helpful, you could add a tiny little bit of micro movement of the head, lifting and lowering the chin, or maybe turning the chin a little bit to the left and the right. And just creating a little blood flow and circulation to these really hard working tissues that sort of connect the neck to the skull. Really good. I don't really want to stop, but I'm going to offer you now the option to go to the other side. As I said, this is an area that can be quite implicated in headaches. So again, ball right behind the ear. I'm more really on the skull than on the neck per se, and I'm just looking for that sore, maybe slightly dull, achy, tender spot. Just deep breath. Again, you can be still and just breathe, or maybe finding a little nod of the head, chin up and down, or side to side. Just taking a couple more breaths. And then for our last technique for the neck, I'm going to use the two myofascial balls back in their tote bag. And where we're going for here is the occiput. And what we're really looking at is this area right at the very base of the skull, where the skull and the neck meet. And there are these tiny little muscles, the occipital muscles, and tiny little ligaments that connect, as I say, the neck to the skull. This is a common tight area, mainly because of our forward head position. This area often gets very kind of locked up. And It's sometimes, I think, referred to in sort of craniosacral work as like it's called the still point inducer, because it really has also a calming effect on the autonomic nervous system. So this is a great one for stress. So the balls are going to be on the block, and I'm going to come down and really just rest that base of the skull right into the balls here. So I'm basically cradling that very sort of bottom part of the skull with the balls, and I can just, my chin will drop in slightly towards the chest, so the back of the neck is being slightly lengthened out as well. And you just want to situate yourself in a way where you can really relax your shoulders, your upper back. You might like your knees bent or straight. And if you're in a place where you can close your eyes, I'm going to recommend that your eyes close, because the muscles that we're working on here also have a role in moving the eyes, and therefore relaxing the eyes really just further enhances the therapeutic effect of this technique. Now, obviously, because the balls are not completely stable, you can do a little bit of movement here, but the movement will be quite minimal, so that you're not obviously disturbing that sense of stability of the head and the neck. So if it feels good here, you could play a little bit with just lifting and lowering the chin. And I'm literally just barely moving the balls up and down a few millimeters, not much. Just lifting the chin. You could also bring the head back to neutral and play a little bit, maybe with turning the head very slightly to the left. So there's a little bit more pressure through the left ball, the left side of the skull there. And also going a little to the right. Again, I'm not moving a whole lot here. I want to sustain stability, steadiness. And you probably can't hear through the camera, but my digestive system, my stomach is gurgling. And this is actually one sign that the nervous system is starting to switch into that parasympathetic state. Find your digestive system starting to really kick in. Other signs that the relaxation response is happening is you may feel your eyes watering a little bit, or more saliva in the mouth, or just a sense of the breath deepening, softening in the belly, feeling a little more sleepy or relaxed. And just using very gentle, small movements to just investigate any tender spots here. So then my experience when I teach this to students and private clients, this is definitely a favorite, and many people say they could do this all day. So if you're enjoying this, feel free to extend your time here. But if you need to close your practice at this point, just lifting the head up away from the balls. You can use your hand to support your head, take the props out, and just come to lie back for a moment with the head on the ground, or again, you could always put a cushion back under your head for support. And again, just take a few moments to just notice you're feeling the blood flow or circulation in the neck. Maybe a shift in the overall tone of the body. And
And you're welcome to remain here for as long as you like. When you feel the need to come back, you can roll to your side, use your hands to come up rather than your neck to bring you back upright. And I hope that that practice helped ease tension in your upper back and your neck. And feel free to comment and give feedback below. Thank you for watching.